up, guys? Katie Kleber with Fresh RN, and let's talk about what kind of patients are you going to see if you're on a Med-Surg unit. So remember, Med-Surg stands for medical surgical. Surgical meaning they had some sort of surgery during their stay. Sometimes those are people who had a scheduled procedure and they're normally have to stay in the hospital a night or two. Sometimes it's someone who had a surgery with unexpected complications. Compare that to a medical patient. A medical patient is someone who has an issue that's causing them to be in the hospital, but didn't necessarily involve surgery. Or you could have someone who had a surgery that had a medical issue that came up, and both of these things are a priority to deal with. So let's talk about some that you might see. So naturally, you're going to see some patients after some surgeries. So common surgeries that keep patients in a hospital are hip replacements, knee replacements, various cardiac surgeries, cancer surgeries. Let's see. Other ones, maybe a Whipple procedure. That's kind of a bigger surgery. Bariatric surgery. Many times that requires an inpatient hospital stay. So you could be taking care of one of those patients. You could also have a patient who suffered a fall or an accident. When I worked Med-Surg, I saw a lot of patients that were in MVAs, motor vehicle accidents. So that could be a patient from a car accident, a motorcycle. I saw quite a few ATV accidents as well. Multiple fractures, needing various surgeries, lung issues. Lots of contusions and abrasions and issues like that you can also see. Another common Med-Surg patient would be a patient who is being admitted for diabetes. So severe complications, maybe they are in diabetic ketoacidosis, DKA, and recovering from that. Because if someone is in the really acute stage of that, they're in the intensive care unit, but when they're recovering and their blood sugars have stabilized, they'll go out to the Med-Surg unit. You'll also find that diabetes complicates quite a few other things. So you might see patients who are there with for other reasons, but are having a very serious issue with their diabetes. So that may be a type of patient you're going to see on a Med-Surg unit. Another patient in the Med-Surg unit could be someone who has an advanced infection. So that means someone who might be developing sepsis, or we're watching out for them to develop sepsis, someone who has pneumonia requiring IV antibiotics, or maybe they have a wound somewhere on their body that the infection is no longer just like an issue in the wound, but they're getting a fever, their white count is crazy, they're not responding to whatever antibiotics maybe were given outpatient. A lot of times you'll see patients who have advanced infection, relatively stable, but maybe they need IV antibiotics for a certain amount of time, and we're getting them set up to go home and get a central line placed and all that stuff. So advanced infection will also be on a Med-Surg unit. Finally, another patient example of someone on a Med-Surg unit could be someone with a gastrointestinal bleed. So that means that anywhere from the mouth all the way to the end of the road there, they could be having bleeding. And some people think that's like this gushing blood coming from their stomach. No, you could have ulcers that are actively bleeding, but it's kind of like a slow trickle, and it's enough where it won't heal on its own without intervention, and where it's causing anemia or other issues. So a lot of times you might be sending those patients down to endoscopy to maybe get a colonoscopy or an EGD to see what's going on, and address it as best that they can. Then also you might be given blood products and fluids to support them. And if they're getting bad enough, they may be in the ICU. Or you could have someone who was really bad in the ICU. Now they're stabilized enough to be on your Med-Surg unit. So those are some examples of patients that you will see on a Med-Surg unit. So let's review again. Advanced infection, diabetes complications, injuries from motor vehicle accidents or falls, recovering from major surgery, and gastrointestinal bleeding. There's many more types of patients you're going to see on a Med-Surg unit, but those are just a few examples. If you've got any other patients that you've actually seen on the Med-Surg unit, make sure you comment below. And if there's a lot that you see all the time, I'd love to hear that as well. Make sure you like and subscribe and check out my email list. There is a link to it in the description of the video. I will send you weekly tips and tricks and advice and stories from the bedside directly to your inbox every single week. Thanks, nurses. Stay fresh.